Before modern medication became available, treatment for schizophrenia largely involved placing patients in long-term psychiatric hospitals and providing a safe, structured environment. Progress was limited. After dopamine was identified in the early 1950s, researchers developed drugs that could influence this neurotransmitter system. Some substances, like amphetamines, produce psychotic-like symptoms in healthy individuals, whereas others reduced such symptoms in diagnosed patients. These therapeutic drugs became known as antipsychotics. Antipsychotic medication aims to help people with schizophrenia function better day-to-day and improve their sense of well-being. They are usually offered first to stabilize symptoms, with psychological therapies added later. All antipsychotics reduce dopamine activity in brain pathways linked to schizophrenia. Typical antipsychotics. Typical, or first-generation, antipsychotics, introduced in the 1950s, primarily target the positive symptoms of schizophrenia such as hallucinations and delusions. They work as dopamine antagonists. They bind to D2 receptors, particularly in the mesolimbic dopamine pathway, but do not activate them. By blocking dopamine's effects, these drugs reduce overstimulation and therefore lessen psychotic symptoms. People often experience a reduction in hallucinations and delusions a few days after starting medication, although improvements in other areas may take longer. Research suggests that roughly 2/3 of D2 receptors need to be blocked for the drugs to be effective. However, this widespread receptor blockade also affects dopamine systems in other areas of the brain, leading to unwanted side effects. This is one of the major drawbacks of typical antipsychotics. Atypical antipsychotics. Atypical, second-generation, antipsychotics were developed to address the limitations of earlier drugs. They are associated with a lower risk of movement-related side effects, may offer some help with negative symptoms, and are often used when patients do not respond well to typical medication. Like earlier drugs, atypical antipsychotics block D2 receptors, but they bind more loosely and release more quickly. This rapid dissociation means normal dopamine transmission can resume sooner, which is believed to reduce the likelihood of movement problems. Drugs such as clozapine also have a stronger action on serotonin receptors, especially 5-HT2A receptors, and a weaker action on dopamine receptors. This wider receptor profile is thought to explain their different clinical effects. Although both typical and atypical antipsychotics reliably reduce positive symptoms, the evidence for atypical drugs improving negative symptoms or cognitive deficits is mixed and less consistent.